I am Dr. Ruchika Verma, a postdoctoral fellow in the Department of Psychology, University of Allahabad, is going to give you a lecture on the topic Adolescent Health, Early Marriage and Early Childbearing, Sexual and Reproductive Health Issues of Adolescents and Young Women. This lecture will cover the adolescent health issues, and this has been originally written by Dr. Nalini Tandon, former Medical Superintendent, ESIC Hospital. Who is an adolescent? Adolescence is the period in human growth and development that occurs after childhood and before adulthood from ages 10 to 19. It is a period of storm and stress when there are a lot of emotional changes, hormonal changes takes place. This is an age when the body is maturing and not completely matured. It is developing and not fully developed. It is in a process of transition. In females, the development of body, the adolescent period the remarkable event is puberty and menarche. In females, puberty is caused by alterations in brain functions that result in increased secretion by the hypothalamus of gonadotropin releasing hormone, which is called GnRH, and due to these increased levels of hormones stimulate secretion of pituitary hormones, which is follicle stimulating hormone and luteinizing hormone. This causes follicle development and estrogen secretion. Estrogen is responsible for accessory sex organs and secondary sexual characteristics. So, during adolescence, the event of puberty results in lot of physical and biological changes in the body. Menarche is the onset of the first menstrual cycle, which occurs at about 12.5 years of age and as a result of release of follicle stimulating hormone. Actual age may vary from 10 to 15 years depending on the different kinds of girls, their nutrition and many other factors. The girls who have started menstruating do not produce eggs for fertilization till 2-3 years later. The production of eggs takes place after the 2-3 years of menarche. Now, what is the main issue which is responsible for the poor reproductive health of adolescents? For the poor reproductive health, an important aspect is the ignorance. Where is the ignorance? Lack of sex education, cultural beliefs, taboos, fear of girls being molested, low status of girls in society and other such practices lead girls to be married soon after menarche. There are a lot of factors which result in, these are the factors which results in the early marriage of girls soon after the onset of puberty. Alternatively, adolescent girls and boys often indulge in overt or clandestine, unsafe sexual activities without realizing the consequences of their implications, of the serious implications which can take place as a result of unsafe sexual behavior. In subdeveloped countries, girls are allowed to marry in their teens with parental consent. There are harmful, these are something which can have devastating and harmful effects on the society and on specifically on the adolescent girls. This has become a major problem and all over the world, and India is not far from this problem. It has been seen that major reasons for early marriage of women in most of the developing countries is, first is the most common reason is the traditional system, that is due to the cultural beliefs or the traditions, rituals and norms of a society. The 27% of girls who are married before the age of 18, they are married because of the traditional systems. Then there are some other reasons which only 18%. Then due to pressure of dowry, 16% of girls they get married. Then pressure from relatives, 13% of girls they get married. Then due to safety and security of girls, security problems of girls, many parents they get their daughters marriage at an early age, and this is only 10%. Then pressure from family members or other issues like land ownership related issue or economic hardship and poverty, these are 4 and 2% respectively. So, what is the magnitude of the problem? From where the problem is coming and what is the real seriousness of the problem? Nearly 16 million girls between 15 and 19 give birth annually, almost all of them in developing countries. In developing countries, it is a major problem that girls are getting married at an early age, and that leads to teenage pregnancies. Frequently, young women get pregnant under pressure because they do not know how to prevent it, or because they are forced to have sexual relationships. Each year, as many as 4 million adolescents aged between 15 to 19 years obtain an abortion, and millions become infected with curable sexually transmitted diseases. Globally, 40% of all new human immunodeficiency virus (HIV) infections are spreading among 15 to 25 years old, and these estimates are progressively increasing in the recent years. Each day there is an increase in the problem, and the problem is becoming more and more serious day by day. The question is that why these adolescent girls are getting married, or without marriage they are indulging in the sexual relationships. These are two different things, within the institution of marriage or beyond the institution of marriage. If girls are included, if girls are inclined towards the early sexual behavior, then an appropriate amount of sexual education is a must, because without the proper knowledge these girls are indulged, and the consequences, and there are serious consequences for both boys and girls. So, 3% of 19 million unsafe abortions per year happen in developing countries. These unsafe abortions are nothing but due to poor knowledge of sexual relationships and indulging in sexual relationships in an immature manner. 2.5 million, almost 14% of all unsafe abortions in developing countries are in women younger than 20 years. So, the most common route to risky sexual intercourse for adolescent girls in developing countries is through marriage, because in developing countries the practices of early marriage through family members is still very common. Many of these young wives become pregnant. More than 90% of the 14 million birth adolescents are in developing countries, most of them within the context of marriage. Although the poor adolescent health is observed mainly in the marital relationships, but the problem is existing beyond the marriage also. Many of the physical abuses along with physical coercions are also seen, and is one of the problem of adolescent poor sexual health. Young people aged between 15 to 25 years living with HIV. AIDS has become a very significant problem, and is very common among developing countries. Some of the important health risks are early pregnancies and childbearing may lead to following health risks, causing untold misery and often lifelong morbidity. Some of the common health risks due to early pregnancies are anemia, unsafe abortions, fistulas, prolapse, sexually transmitted diseases, and of course HIV/AIDS. Now, from these risks, the most common consequence is mortality. Major causes of death among young girls in developing countries are childbirth and unsafe abortions, because most of the adolescent girls who are unintentionally or without any awareness of sexual health, they indulge in sexual relationship through marriage or outside it. They have to face the consequences of unexpected childbirths, unsafe abortions, or any serious kind of sexually transmitted diseases. There are certain psychosocial risks also, like for example, depression, insomnia and anxiety, lack of education, premature and low weight children, and increased infant maternal mortality. So, these are the problems which are faced by adolescent girls. From ages between 15 to 19 years, the teenage pregnancy has certain serious consequences. For example, 16% of them they faces fetal losses, 56% they have live births, but it resulted in poor health of the child as well as mother, and 28% of them they experienced induced abortions. So, the problem has a very serious gravity, and that needs proper intervention. Now, what are the hindrances and what are the problems which are faced while dealing with adolescent pregnancies. The first most common obstacle is lack of sex education. In India, the girls hardly get any education about sex. They don't get any information from their family members, and the most common source of information is their peer group, which is as mature as themselves and give them incomplete information. Second important problem is the lack of access to healthcare services. Because these girls, because of social taboos, they don't tell their problems to anyone, and as a result, they face serious health consequences. Because of the social taboo, they hesitate telling their sexual problems even to their mothers, and as a result, they have to face such kind of serious sexual problems that it leads to a threat to their lives. Then the third obstacle is lack of privacy and respect for their requirements. It has been commonly observed that adolescents who are involved in marital or extramarital sexual behavior, they are very less importance is given to their privacy issues and their requirements. There is a lack of caring and understanding health workers even in various hospitals, because of which they are not handled, they don't get the kind of attention and counseling which they require at the time of crisis. There are certain other obstacles also, like for example, lack of legal recourse, as governments relegate their needs to the backbench, because government don't give attention to such problems. For example, if an adolescent girl comes to the hospital with a problem of excess bleeding or a premature abortion, then these girls have to face lots of legal formalities, due to which their health suffers a lot. Then lack of problems to the parents and adults understands the harms of childbearing and early marriage. Now, what is making health services, how to make health services more adolescent friendly? There are certain things which are very unique. Adolescent is a period when they need attention of the elders also, and there should be someone in their life who should understand things from their perspective, because they are facing a period of transition. It becomes very difficult for them to understand their own needs, as well as they have to fit in the existing molds of the society. There are certain issues on which adolescents often object, like for example, they want to have a say in decisions about their health. They want their privacy should be respected. They don't want to be treated like a child, and they don't want their parents to tell everything. So, to improve the quality of lives of the adolescents, it is very important that their needs should be addressed at different levels in different ways. The next point is actions and interventions required. What kind of actions and interventions are required to prevent early pregnancy? For example, although the rules has been passed that the marriage age for girls is 18 and for boys it is 21, and to how can we prevent pregnancies before the age of 18? These are something which needs to be, there are certain things which needs to be handled in a proper way. Like for example, increasing the use of contraception by adolescent at risk of unintended pregnancy, because the adolescents who are at risk, for example, young girls living in slums, small houses, they are very much at risk of unintended pregnancies and involvement in sexual behavior. In those cases, adolescents can be given proper knowledge about the sexual prevention from the pregnancies and reduce co-ed sex among adolescents. That is also one of the ways in which we can prevent early pregnancy. Now, how can we prevent adverse productive outcomes? We can prevent it first by reducing unsafe sex among adolescents and by increasing the skilled antenatal, childbirth and postnatal care among adolescents. It is a very common problem which has been observed that the postnatal care in the case of teenage mothers is very poor and hardly any attention is given to them. Now, what are the main steps to achieve these goals? How can we proceed and how can we look for for how can we actually bring about a change so that we can improve the conditions of adolescent girls. First is making clinical services available. Second, providing contraceptive and STI prevention services. Third, providing antenatal, perinatal and postnatal care. Antenatal means during pregnancy, perinatal means antenatal means before pregnancy, before the birth of the child, perinatal is during pregnancy and postnatal is after pregnancy. Providing effective sex education is also important, because sex education, although in India it has been promoted to some extent, but still in most of the cases where actually these adolescent pregnancies are found, there the sex education is very poor. General awareness of the society at large. Developing skills in adolescent girls, development of skill giving training to adolescent girl is also very important, because these days these girls, if young girls in especially living in poverty areas, these girls, they are not involved, they are not literate, not going for education and involved in some kind of domestic help works. So it is very important that they should be encouraged to develop certain skills like stitching, cooking, beautician or such kind of skill development which can develop and make them independent and more economically independent. Considering the living conditions of the adolescents is also very important, because at some places the living conditions are so poor that they cannot even avoid such kind of situations where the environment itself is vulnerable to such kind of crimes. Making awareness about the contraception and safe abortions. This is something, the knowledge about the sexual behavior, onset of sexual activity, age at which the sexual activity has been started, all these issues needs to be addressed well in advance so that the condition of adolescents can be improved. Now, what is the role of the health workers? Making health service, it is very important that health services for adolescents should be made adolescent friendly. WHO is working in this area, and they are trying to bring lots of facilities for adolescents and handle their medical problems. It is very important that we need to be adolescent competent, and the trainers should be competent enough to understand the health needs of adolescents. It is very important to communicate clearly and encourage adolescents to talk openly. There should not be any stigma attached to the boys and girls who talk about these issues in an open way. We have to respect their privacy and confidentiality. Confidentiality is very important because of the social norms, social values and social pressures which these adolescents face, and as a result they do not tell their problems to anyone. And they should be empowered, we should empower young people to make decision about their care. It is very important that these adolescents should be made independent and should be encouraged to take their decision in an independent manner. What government can do? What is the role of the government? Government has made many policies at the level of central as well as state level, where they can address the needs of adolescents. It has been seen that the most important issue is that the adolescent health services should be affordable. There should be some services which should be free and some should be at the minimum cost. When we count adolescents from 10 to 19 years, this is a distinct group in health statistics, and this is a group which needs special attention. It is very important to involve adolescents in the design of health policies and programs which can affect them. So, a proper research is required to understand the health needs of adolescents, because till date most of the policies, most of the women reproductive health needs are addressed keeping in mind the needs of women who are beyond the age of 18 and who are in the realm of marriage. But now the problem which is faced by adolescent girls is not only within the marriage, despite it is outside the marriage also. So, it is very important to understand the needs of adolescent from that perspective also. Then The next point is that there should be supportive training staff and health professionals in adolescent health, and there should be the laws should be ensured and policies should be protected, should protect the adolescents' rights and dignity. It is very important that adolescents' rights and dignity shall be maintained and should be protected. What adolescents themselves can do for themselves. First of all, it is very important that right from their socialization, the children should be socialized in such a way so that they can discuss their problems whenever they need to. The children should encourage to discuss their problems with their parents, so they should not hesitate to talk about sensitive topics, and the health workers who are in the hospitals or other places should be there to listen without any judgment. It is very important that an environment of unconditional positive regard without passing any judgment should be given to the adolescents. Then there are local health services which are available, and it is very important for adolescents themselves to ask their health worker for more information to help make decisions about their health. So, if they are not themselves aware of their health needs, then nobody can help them. So, it is very important that adolescents should be encouraged to be aware of their rights to privacy and confidentiality also. So, they should know that they can, maintaining the confidentiality, they can discuss their problem with the various health workers. They can speak to a trusted adult if they experience some kind of discrimination or disrespect, and they can also provide feedback to the health center on how they can improve services for them and their friends. So, adolescents, if they are going to some hospitals, it is very important that they should understand the hospital should understand the needs of adolescents in a more clear manner. There are then the 25 worst countries for child marriage are in like Nigeria. Then there are countries like Bangladesh, where 66% of the population is like child marriage. Then Central African Republic 21%, Ethiopia being on 49%, Afghanistan 39%, Zambia 42%, Uganda 46%, and then Madagascar 39% and Senegal 39%, India being on 47%, where the 47% of women they get married before the age of 18 years. Now, what are the main objectives? Objectives are that of this module is to make the reader aware of the health problems faced by adolescent women, particularly due to child marriage and early pregnancies. After going through the study of this module, the student should be able to understand and comprehend that adolescent pregnancy remains a major contributor to maternal and child mortality and to the cycle of ill health and poverty throughout the world. Next important thing is that worldwide more than 700 million women alive today were married before their 18th birthday. More than 1 in 3 entered into union before age of 15. Early pregnancies are more frequent among the poorest and least educated adolescents. Estimates indicate that 46 million of total pregnancies of the world are voluntarily terminated every year, 27 million legally and 19 million outside the legal system. So, there are a lot of statistics which are showing that worldwide the problem is serious, and the problem has become a major problem, a major issue for the developing countries. Ending child marriage will help break the intergenerational cycle of poverty by allowing girls and women to participate more fully in society. Empowered and educated girls are better able to nourish and care for their children, leading to healthier, smaller families. When girls are allowed to be girls, everybody wins. Thank you.